67% of Australian parents choose circumcision for their sons, yet when surveyed after making that decision, 43% couldn't accurately explain why they chose it. Here's what the medical evidence actually shows about the world's most common surgical procedure. I'm Dr. Fergal Armstrong, and today we're examining circumcision through a medical lens. We'll look at the research on benefits, risks, and what current Australian health guidelines actually recommend. This isn't about taking sides, it's about understanding the evidence so you can make an informed decision. Let's start with the strongest medical evidence. 3 randomized controlled trials in sub-Saharan Africa found that circumcision reduces HIV transmission by approximately 60% in heterosexual men. This led the World Health Organization to recommend voluntary medical male circumcision in high HIV prevalence settings. But that's not the only documented benefit. Urinary tract infections in infants drop by 3 to 10-fold during the first year of life in circumcised boys. Given that UTIs affect about 1% of boys in their first year, this translates to a meaningful protection. There's also evidence for a reduced risk of certain cancers. Penile cancer is extremely rare, affecting less than 1 in 100,000 men annually. But circumcision does reduce this risk. Some studies suggest female partners may have slightly lower cervical cancer rates due to decreased HPV transmission. Now, let's talk about complications, because every surgical procedure carries risks. In newborns, when circumcision is performed by trained professionals, serious complications occur in less than 0.5% of cases. We're talking about major bleeding, severe infection, or injury requiring additional surgery. Minor complications are more common, around 1 to 5%, and include minor bleeding, localized infection, or cosmetic concerns. Adult circumcision carries higher risks, with longer healing times and more pain. Here's what's important. Complication rates vary dramatically based on who's performing the procedure and where. Hospital settings with experienced practitioners have much lower rates than traditional or non-medical settings. The Royal Australian College of Physicians has a clear position. There's no medical indication for routine infant circumcision. They acknowledge the benefits we've discussed, but conclude that in Australia's low HIV prevalence setting, these don't outweigh the risks and costs of routine circumcision. This differs from some other countries. The American Academy of Pediatrics states that the benefits outweigh the risks, but stops short of recommending routine circumcision. It's a nuanced position that emphasizes parental choice. What does this mean practically? Australian healthcare providers will perform circumcision if parents request it, but they won't actively recommend it as a routine medical intervention. Now let's address some misconceptions. First, does circumcision affect sexual function? Multiple studies show minimal differences in sexual sensitivity or satisfaction between circumcised and uncircumcised men. The idea that one is definitively better than the other isn't supported by research. Second, hygiene. Uncircumcised penises are not inherently unhygienic. Proper hygiene practices are effective regardless of circumcision status. Teaching boys to clean under the foreskin when it naturally retracts is straightforward. Third, circumcision doesn't prevent all sexually transmitted infections. While it may reduce the risk for HIV and herpes simplex virus type 2, it provides no protection against many other STIs. Safe sex practices remain essential either way. Medicine doesn't exist in a vacuum. For many families, circumcision carries deep religious or cultural significance. Jewish and Islamic traditions include circumcision as a fundamental practice, typically performed according to specific ritual requirements. These cultural factors are valid considerations alongside medical evidence. Healthcare providers should respect these values while ensuring families understand both the benefits and the risks. The key is having an open discussion between families and healthcare providers, considering medical evidence alongside personal, cultural, and religious factors. If you're considering circumcision for your child, here's what matters most. The procedure is generally safest when performed by experienced practitioners in sterile conditions during the newborn period. Pain management is crucial regardless of age, with various anesthetic options available. Key safety factors include practitioner expertise, sterile technique, appropriate anesthesia, and proper post-operative care. Be aware of warning signs like excessive bleeding, signs of infection, or problems with urination. In cultural or religious contexts, ensuring the practitioner has appropriate medical training is essential. Traditional methods, without proper medical oversight, carry higher risks. So where does this leave us? The medical benefits of circumcision are real, but generally modest in low HIV prevalent settings like Australia. The risks are typically low when performed by trained professionals. This isn't a decision medicine can make for you. It's about weighing evidence against your family's values, cultural background, and personal preferences. What matters is that your decision is informed by accurate information, not myths or incomplete data. Whether you choose circumcision or not, both options are medically acceptable when proper care is provided. What questions do you still have about circumcision? Drop them in the comments below. I read every one of them and often address them in future videos. If this helped clarify the medical evidence, hit subscribe for more evidence-based health information. Thanks for watching MedHeads, where we break down medical evidence without the hype.